Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you, the trainer. This is a series of speaking sessions, super solid speaking sessions, the never-ending, non-stop, non-nuisance. Fine. Today we are going to do the speaking sessions for insulin injections. Speaking sessions role play number 1. At Practice with Peter, the English language doctor. And you see the role play card for the patient, the role player, or the interlocutor. That is, I'm going to do today. And here is the card for the nurse. And this is a one-on-one speaking session, personalized speaking sessions for the most serious students. And this is the card. As and when we require, we'll be placing it there on the request of the candidate. Now, today we have the candidate, nurse Kausar Jabin from Karachi, Sindh, Pakistan. She's been a very good student. She's working really hard, and I appreciate her for her seriousness. Right, Kausar. Hello, Kausar.
Yes, sir. Good evening,
Yes.
sir.
Good evening, dear. We are going to start the session, and
Right.
this is speaking role play number 1 at Grandmaster class. Diabetes, insulin injections. Yes, nurse, you can start now.
All right, sir. How I will address you?
You can call me Lincoln because my name is Abraham Lincoln.
All right. Hello, good afternoon. This is Kausar, registered nurse from Community Health Center, and I have been sent for through your GP. And I'm here to see Mr. Abraham Lincoln. I'm in the right place.
Yes, nurse, you're absolutely right. This is Abraham Lincoln, and this is my house. Come on in, please have your seat, nurse. What made you come here?
Thank you so much, Mr. Lincoln, for inviting me inside. And I'm here to talk about your insulin injection. Is it okay for you to talk now?
Yes, nurse.
All right. Thank you for allowing me to talk. And your GP has advised that your sugar level is not under control. So that's the reason I am here to discuss with you to have an insulin injection. Okay.
Yes, nurse.
All right.
But
so
I want to know, nurse, let me tell you one thing, because I believe that I have been managing my diabetes well, extremely well, with my diabetes diet, medication, and prescribed exercises. Everything is going on smoothly. Then why? What made the doctor? What's wrong with him? Why does he want to change my medication plan?
Yes, Mr. Lincoln, you are right that insulin, sometimes diabetes also can be controlled by medication or oral medication with diet or exercise. But unfortunately, sorry to say that your insulin level is higher than what we expected normal. And your HbA1c level also a little bit higher than the normal. So that's the reason your GP advised you to have an insulin so to control your sugar in a well manner, right?
Fine, nurse. I want to know if there is any other way to manage my diabetes, because I am scared of these injections, leave alone taking all by myself. And let me know if any other possibilities. I'll be very much thankful to you.
Yes, Mr. Lincoln, your fear is reasonable. Sometimes people are afraid to get insulin injection, but right on this stage, sorry to say, as we have so many ways to control diabetes, like we mentioned earlier, your diet, your exercise, your oral medication. But on this stage, for you, insulin injection is very important. It's crucial, really, to start insulin injections to control your blood sugar level. All right.
Yes, nurse. And okay, if there is no other possible option, then of course I give you the permission. Yes, go ahead. Can you please explain me the procedure of taking the injections?
Sure, I'm here to explain you the procedure, so you will be able to manage insulin injection by your own, Mr. Lincoln, okay?
Yes, nurse.
All right. First of all, we have insulin injection, and you have to select a side for on your body that on your right and left arm. There is two side and lateral side of your thighs, and on your abdomen, 1 inches away from your umbilical cord. These are the suitable site for insulin injection that we can give. So you can select any site which you are comfortable with. And first you have to clean the area with alcohol swab. Then you can have your insulin injection, what has been prescribed dose, clean it, and gently just push that insulin injection on your side what you have selected. All right.
Okay, nurse. And should I change the place where I take the injections, or should I take the
yeah.
injection in the same place every day?
No, Mr. Lincoln, every time I would suggest you to change the place, as if you will take the insulin injection on a same place every day, it will be, it can make bruises, or bruises mean your little veins can rupture on the same side. It can cause also a wound. So that's why I would like to suggest you to change the place every time. So you will not feel pain on your area where you have taken insulin injection before. All right.
Yes, nurse. And how is that possible, nurse? I have a big doubt. I'm not a medical professional, and
Right.
I'm not a nurse either. Then how I am going to take these injections all by myself? And my question is, if something goes wrong, or if I do some mistake, then what am I going to do? Will there be any side effects for these insulin injections?
Mr. Lincoln, your question is reasonable, but I can assure you, you will not be mistaken, as that's why I'm here to explain you and teach you how you can take the insulin injection in a right way. So that's why I'm here to come to you to train you for that. And so many people, those they are not professional, and but they are diabetes patients, so they are taking their insulin by their own. So I would like to assure you there will be no side effect for the insulin injection, because it's already cross-checked by your doctor, and you will be all right. You will be you can manage by yourself. By might be initially it will take a little time, but you will learn, and it will be okay for you to take insulin injection. All right.
Yes, nurse, of course, that's really fine. And what about the used syringes? Can I reuse them, or should I dispose them off immediately?
No, you should not use the syringes. It is not reusable. You have to throw it in a proper yellow. There is yellow container, what we call it sharp container. I will give you, and it will be provided through the community health center. And you have to throw the needles in that box, so nobody will hurt by that needle, even yourself. And when it's 1/4 already, you can inform, and it will be replaced by the new one. All right.
Yes, okay. Thank you very much, nurse. You have given me a lot of information. That was
All
really
right.
wonderful. If you have anything else for me to know, then please tell me.
Okay, Mr. Lincoln, it's good that you have understood everything. So I just would like to ask you, you have understood so far what we have discussed until now?
Yes, nurse, absolutely fine. Thank you very much.
All right, Mr. Lincoln. So, so I'm sure you will be able to manage injection by yourself. And in case you have any problem, you can contact the community center. So I will be here to help you again. All right.
Right, that's very nice. Now I'm going to give you some feedback. Okay, thank you very much for
Thank
your
you, sir.
yes.
Okay.
Now I'm going to give you some feedback. Listen to me very carefully.
Right.
Number of times you're saying like that. These
All right.
are called unnecessary sounds. Better you zip your mouth when
All
you
right.
don't have anything to speak. And then secondly, there are many pauses and breaks. You have to avoid those pauses and breaks. And thirdly, you are very confident in speaking, but the problem which you are doing is, you know that there is only one patient, and that one patient is Mr. Lincoln. So why are you telling that name? Why are you using the name Mr. Lincoln 101 times? There is no need, because there is only one Mr. Lincoln. There is no 3 or 4 people at least to say that you are talking to Mr. Lincoln. Even if you are talking to Mr. Lincoln, it's one time to confirm that you are Mr. Lincoln. You are going to ask. Afterwards, there is no need, because you have only one patient in front of you, and you are quite sure that so what special effect it is taking there? Okay, there is no meaning in taking the name of Mr. Lincoln so many times. So avoid taking the name of the patient so many times. It doesn't look fine, you know, for my name to listen again and again. Next one. Secondly, those pauses and breaks you can avoid, and you can control your mouth, and you can close your mouth. Don't open. Once you open, the sounds will come automatically. So avoid that one. And lastly, okay. So that's it. So